Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
Remember my first birth? I didn't know what to do. I didn't know where to look, what to say, to laugh, to cry, to vomit, to faint. I didn't know what to do. But like, it was amazing at the same time. I remember going home being like, oh my God, like, saw birth.
Arriving into the Rotunda delivery suite for their first baby are teenagers Savannah and Brandon. The first time they met, it was like an Irish take on West Side Story.
We met on the beach in 2013. It was the fight on the beach.
I'm from Ballyone, then she's from Killock, and they don't get along, so there was a big fight, and then she seen me and she goes, "Oh, you quickly run." It's a weird first time, yeah.
It was up and down, breaking up, and then two years ago,
Yeah.
we got back with each other, Papa, and that's...
It's been consistent then, yeah.
Lovely.
Until women are in established labour, they stay in a 5-bed ward next to the delivery suite called the Annex. With only curtains between the beds, patients are intensely aware of the other labouring mums around them. After 36 long hours in the Annex with little sleep, Savannah is at last on the move.
One of the midwives had examined her out there and she'd got to 3 centimetres. I think she was really, really relieved because she'd been there for a while.
I'm surprised. I thought I was gonna come in like,
Yeah.
like, cause the girls I saw, like from the 2 days that I've been here, the girls that I've seen that have came in here, are just all screaming.
Really?
I was like, oh my God, I'm shitting.
But it just depends. People will react
And
differently.
then mine was just like, I just started crying.
I know. Well, that room can be very scary. And the thing is, you don't know what's going on with anybody else. Like, there could be something else other than just labour going on with them. So
Younger mums, they have a lower incidence practically of everything. I suppose at that age, your body is really built to have babies, you know, to go through childbirth.
That must be an old fashioned.
This is, yeah. So in one respect it is good, but also, yeah, I suppose socially being a young mum is difficult and it is tough.
4, 5, 6, 7, 8 pencils. I really wasn't expecting
Hey, where's Savannah? Savannah, Mandy.
She's just in room 9.
All right, perfect. I just walk in, yeah? All right, thanks.
Knock on the door.
yeah.
Can I come in?
Oh, hello. How are you?
I never looked after myself. You know, like my mum would have to remind me if I had any appointments, or she'd have to wake me up to go to school. I never cooked or anything, but then I started to cook for myself and all. Then when I said, right, I can start doing things for myself, I said, right, now be ready to look after someone else. Can you send juice before the 5th of February ends? Because my birthday's tomorrow.
Is it? Oh my God. What age are you going to be?
19.
Oh my God.
Yeah.
Oh, that'd be cute though, no?
Yeah.
The two of you are the same birthday, yeah.
No, he can have his own day. I'm only messing. He's worth it.
This is my new little technique.
Actually, just do a massage here because it's sore. No, but just do properly, please.
Pretty demanding.
You had a caesarean section before?
Yes.
Okay.
In theatre, Sinman is being prepared for the arrival of her second child at 35 weeks gestation. Just hours ago, she came in for a weekly scan, only to be told she has to undergo an emergency caesarean section.
I told them about a stitch I had this morning after breakfast, and just as a precaution, they're afraid that the uterus might be kind of weakening.
Have you got somebody coming in with you? No, just me.
Her husband Ian is on the other side of the world, in Miami on a business trip.
I flew out on the Sunday and I woke up to a text on the Monday it was when you were getting all your scans and stuff done, saying, guess where I am? And it's like, what?
Great. So we're just going to let that dry, okay? And whenever that's dried, then we'll cover you over, then we'll check again. We were just chatting about the scar, and we're going to go through the scar that Oscar was born through, okay?
Sinman and Ian had their first child, Oscar, 2.5 years ago. At their local maternity hospital, they first heard the news that he has the fetal abnormality, spinobifida, which affects bowel and bladder function and can leave the child with little or no ability to walk unaided.
Where we had the 20-week scan, and we knew that was the day that we could find out whether it was a boy or a girl. It never occurred to us that anything could be wrong. And then people were asking because they knew that we were finding out whether it was boy or girl, and that we were on a scan because I had to leave work early. So we were getting the messages then that evening. But I ended up just texting one group of kind of close friends and getting them to kind of spread the word. We were kind of also kind of offered, there were kind of options abroad that we could think about. I think the fact that that was kind of mentioned kind of made it worse, because it was like, is it just kind of a situation where you would consider that? So once we started researching and just seeing all the children who have spina bifida and are happy, and you wouldn't change them for the world. So it was literally just, say, about a week of
Horror.
Trauma, yeah. But after that, we haven't looked back.
Sinman and Ian's new baby has also been diagnosed with spina bifida.
We had had a chat before saying, okay, well, what if we got another diagnosis? Yeah. So we'd kind of gone through all the scenarios, and we were like, okay, no, we'll be fine with it because, Oscar turned out great.
Yeah.
We're really happy with him. It wouldn't change him at all. So that would be fine.
Yeah, we were saying, if it's another spina bifida case, is what we're used to. So it's just, it'll just be another baby to us.
3 months ago, Sinman was only the second Irish patient to undergo pioneering surgery in Belgium, in which her baby was operated on while still inside her womb. The hole in the baby's spine was closed before nerves could be further damaged, giving him a greater chance of being born with normal body function.
That's the spina bifida, and the nerves are exposed here on the back. This is the extent of the lesion, and it was about 3 centimetres wide, so it was quite a wide lesion on the lower back. Once they had repaired the nerves and covered over the nerves, they then created a skin flap.
The procedure will bring Sinman's baby benefits in the long term, but the doctors are concerned that it carries risks for mum and baby during pregnancy.
There is a scar on the uterus that needs to go through the stages of healing, but the uterus is growing as the pregnancy is advancing, and there are considerable risks associated with that. That scar can weaken, or indeed can even rupture.
Okay, how are you feeling there, Savannah? Great. So we just started. So it'll be a couple of minutes before this baby is born, okay? This blue area here of the stitches that they used whenever they were doing the surgery back 10 or 11 weeks ago. You're doing okay there? You're feeling all right? Yeah? Excellent. Okay. It's very thin there, isn't it?
It is.
You know what? I think I'm just going to go in just above that. Yeah. So there's the waters are gone.
So we couldn't take the chance, given that Sinman complained of some pain, and therefore it was time to meet Rufus.
Now, hello there.
Hello.
So do you want to hold up, baby?
I will indeed, please.
Here we go. So now, got him?
Hello.
Oh, here. Look. Hello. How are you? How are things? He looks great, doesn't he? He's gorgeous. Lovely. Congratulations. He looks fantastic. No, hello, Rufus.
An examination of Sinman's empty womb will let the doctors know just how close she was to a ruptured uterus.
Whenever you feel inside, you can feel that there is a bit of a defect, but it hasn't gone all the way through. So that's good. So that's great. That was our worry today. Yeah. Give him a few kisses. That's brilliant. He's gorgeous and he looks big.
Small they are.
I know. And I'd say he's, because we said what this morning about 6'14". I'd say he's not far off that. Yeah. I look interested to hear now what weight he is. Yeah.
New baby Rufus has to go to the intensive care unit for ongoing assessment. But before that, he gets to meet Mum for the first time.
We really wanted to kind of get off to as good a start as possible. So skin to skin was really important to me, so I got that.
Hello.
If I had €1 for every tin toast that I have given, it's just, and I do tell them it's better than a roast beef dinner. They love the tin toast. Well, would you believe it? My husband took mine on me when I had my son, so they had to make me another bit. Well, I have to say, he had a rough time now, in all fairness as well, because I nearly bet the hoo-ha out of him, you know. I was a bit stressed.
In delivery room 9, Savannah has opted for an epidural to help with the pain.
He thought it was easy. He was telling me, get no painkillers, nothing, go normal. And I was like, I can't stick this pain, like it's really sore. It's not you having this baby, it's me, like.
I thought it was easy. I thought they were just reactions the girls put, you know, an overreaction of screaming.
Yeah. Yeah.
So Savannah, this is Margaret, she's going taking over your care.
I probably am a little bit more motherly to the very young girls. Probably bring that into it a little bit, because I'd be very aware of how my own daughters might have been at that age and how they might have felt had they been in a similar situation.
The hardest part of labour is sometimes getting into labour, especially when it takes a long time like it did for you. So you've done really well. You need to be really proud of your achievement.
Yeah. Yeah. Ready in there, yeah? Pyjamas and that.
Shower cream. Oh, the midwife, would you think these pads are big enough for
No, absolutely not. This is your first line of pain relief, okay? This little button here, okay?
Yeah.
Because now that you have the epidural, we don't want to labour to become too prolonged.
Yeah. My life was alright because my man now was on drugs, but now none of them's on drugs, so it's alright now. It's gone now. Living with my nanny and then all my aunties and then calling them my sisters. That was alright.
As my dad left us when I was 6, he said he was going, I seen him getting in the taxi and then he goes, oh, where you going? He goes, I'll be back. And then he left. But like he still stayed, like, you know, staying supportive of me and my sister. He just didn't want to be with me mad. But whenever I used to get in trouble in school, she'd tell me that. And then he'd buy me something, you know, buy a flick or a PlayStation, whatever. He'd spent more money than time on me and my sister.
Okay, well, you go for a cup of tea. Will you keep an eye on my trace?
I will.
Her oxytocin is due up at
10.
10.
Okay.
So what will we name the kid?
Carson.
Right, we have Carson. What if he doesn't look like a Carson?
It is called Carson.
But what if he looks like a Benjamin?
Someone said to me,
Yeah.
call him Jeremiah. Jeremiah. I said, no. I can't call him that.
Baby Rufus is 24 hours old. After the radical surgery he underwent to correct his spinal cord defect, only time will tell what level of disability he may have in the future.
Good boy. Oh, this looks lovely. So this is the little area where the spinal cord would have been coming out. So they put a little patch there, and it's completely closed over now and healing very nicely. You can see he's got lovely leg movements, so that's what we like to see, because children who have spina bifida sometimes can't move their legs very well. Whether he needs assistance with a walking device, it's too early to say, but we would be hopeful that he would get up on his feet and be able to walk, which is great.
Definitely brought us closer together. Like
Yeah.
when all the kind of even through like the toughest times.
We know each other fairly inside out now, so that when you do have those bad times or those lumpy times, you know, we're able to, you know,
see beyond it.
See beyond it.
Rufus is being moved to the nearby Temple Street Children's Hospital for further assessment. Sinman will have to stay in the Rotunda for a couple more days to recover from the C-section, but she hopes to visit him later.
You see Daddy tomorrow?
I think they're amazing. I think they're an incredible couple, and their children are incredibly privileged to have them as parents. They have put everything into this and accepted everything and accepted all outcomes. There's no rule book that tells you how to deal with these situations, but they're an inspiration.
I know, it's just a lot of machinery. I'll see him in a few hours. It'll be grand.
Congratulations. He's gorgeous.
Well, Savannah, you're 10 centimetres.
Oh. From
10. Are you sure, Mark?
Are you doubting me?
It's 12 centimeters, isn't it?
No, it's 10.
No, like 12 centimeters is the delivery.
No, 10 is the delivery, okay? 10. They displayed a lot of innocence, but enthusiastic innocence about the events that were happening. Your baby's head needs to come down a little bit further. So what we usually do is we usually wait for an hour after you're 10 centimetres, then start pushing then, okay?
Yes.
It's getting worse.
Yeah, it's obviously the baby coming down.
It's like I need to have a shit.
Yeah?
Yeah.
That's exactly what it feels like, pet.
Want to try this?
Okay.
Quick, hurry. Breathe into it. You know?
What? Savannah, that's weird stuff. Savannah, that's weird. Yeah, I tried the gas, but I didn't like it. Nah, I don't know how the girls can take it. It's not a nice feeling.
I love you.
I love you too. Use the gas mask.
Use the gas pet, that's it. Well done. Come on.
What did I tell her to come down to?
One of the first babies I ever delivered, the baby's dad worked in Copperface Jacks. That baby is one of the only babies that I get to kind of see grow up, because every time I'm in Coppers now, her dad shows me pictures of her.
7 hours after arriving into the delivery suite, it's time for Savannah to get into position to push.
You hold my legs up like that.
Savannah, I don't know what your nanny told you. This is not the 1950s. I can't touch you when you're doing this.
You can't, you're...
And push again. Right down into your bottom, really hard. Really hard, really hard.
At the start, it was like watching TV or something. So I was just looking, you know, like watching like Nature Channel or something. So I was just looking, right, how does this happen?
Come on, again. Do you want to sit down?
Can I not look?
And again. The dads may or may not find that they want to look or not look at what's happening. I think Brandon was actually very enthusiastic about looking. I think I had to kind of suggest to him that he'd be better off at the top of the bed. Hands in there, big breath in. No, Savannah, take in a breath and hold it.
I just looked at her as like a ma or something, you know? Don't do this, don't do that.
Come on, no, come on now, don't lose it. No, come on.
I can't.
Okay, Savannah. Savannah.
Go away!
Savannah, stop. Come on, Savannah. No, don't shout at me.
I'm sorry.
Yeah, I know you don't mean to, but listen to me. Listen. Those last two pushes were fantastic, okay? That's the kind of thing that will have your baby out, okay?
It's too many. I can't do too many of them.
All I'm asking you to do is 3 with each contraction.
Oh. My legs hurting.
That's all right. That's okay.
No, I don't want that.
Right, okay. That's it. Good girl. So when you get your next contraction, you're going to give me a big push, okay? Just like the last ones. You ready? Right, big push down there now. Open your eyes, look down. Hello.
Great job.
It's all just a different love, like you feel at first sight.
Yeah, can I just walk out or something?
You want to leave the room?
No, don't.
I just got emotional and I ended up having to leave. Like, you know when you're about to cry, you get that feeling. That was in my whole stomach, so I didn't know what to do. I felt like there was too many emotions in that room. Can I talk to you instead, please?
Sorry?
Can I talk to you instead?
Congratulations.
Yeah,
Are you all right?
Too emotional.
Congratulations.
Oh, no. No.
No.
No.
Did you not believe in yourself? You should believe in yourself. You've done
Oh,
it.
baby. He's so big. He has so big hands.
He's a big boy. He is, yeah.
Yes. What do you want to go with?
I don't mind.
Carson?
Yeah. Oh my God, and you just got him 12 minutes before my birthday.
Oh, no.
I was even afraid just to even hold him, you know, just don't want to do anything. Just leave him the way he's perfect at that. Yeah. I just felt blessed, I just felt happy and all, you know.
I think it's great because not many people, dads or anything, do stay around like that or look after the baby like that.
You're my boy, aren't you? Oh. The same type of dreams you'd have for every kid. You know, I just like them to be better than me, you know. Brought up in a better neighbourhood, just, you know, not as lazy. Yeah, I just hope he be's better than me.
Well, someone once told me before, they said never have a baby, it's like someone has a steel pole and they're biting it off you. Now, after that description, would you ever have a baby? Because I don't think so.
In fetal assessment, Carrie and her boyfriend Fintan are in for a 37-week scan. Although this is their second child, babies weren't on the agenda when they first met.
I kind of would have been at a stage probably like, God, I could never imagine myself having any kids. But like if it happened one day, like it was fine. But I didn't think that I would be 22 and on my second baby. And then obviously things didn't go as they kind of were supposed to.
This pregnancy is progressing normally, but less than a year ago, Carrie and Fintan were told their first baby, Ellie, had a fatal fetal abnormality and was unlikely to survive after birth.
We went back to my house then and we just sat there for the whole day really, just basically crying. And then for every day after that, probably the same thing.
Couples have the option to continue a pregnancy or to interrupt the pregnancy, and every couple comes to it with different values and different life experiences, and our job is not to judge, just simply to provide the information and to be as supportive as we can.
You see her wriggling around there now? So, had a look at her heart a few minutes ago. So here you can see the 4 chambers beating nicely.
You've done very well in Paris.
Now 37 weeks pregnant, Carrie is past the point at which her last pregnancy ended. Back then, despite the likely tragic outcome, they wanted the pregnancy to continue as long as possible.
I said to Fintan, I said I would literally be pregnant for the rest of my life if it meant that she would just still be alive, like inside and stuff. That like just to be able to give her that little life was nice and comforting.
So all absolutely normal. I'm very happy with that. Great.
Well, this is for Ellie, yeah. This one here. It's her little handprint and then a rose, a butterfly and her name.
Now, I know you have the bag packed a million times over.
Yeah.
And I know there's a certain amount of anxiety when you've been through your experience with Ellie of, you know, going into that labour ward and hopefully coming through with a very positive experience in comparison to what you went through the last time. So we understand your anxiety. We will mind you throughout this process. It depends on how you feel about this, but is there something maybe that you have from Ellie that you'd like to bring into the labour ward? Is there, you know, sometimes...
I think we're going to actually bring Ellie with us.
I know, and I think that's lovely.
Yeah.
You know, you have to connect. She's the big sister.
Yeah, I don't think we could bring a blanket. It wouldn't be the same. We'd have to bring her. You can pop her over there.
Many years ago, whenever there was a loss in a pregnancy situation, perhaps as professionals, it was felt that the kindest thing to do was maybe to, not dwell on the loss and sort of, move on very quickly. In the last 20 years, I think we have learned from parents that their preference is that they want to acknowledge their baby so that their lives are moving on, but they're continuing to acknowledge that baby they lost.
I think we'll have her by tonight. I've good feelings. Just walked the same way we walked a minute ago. They've just gave me hormones to try and bring on labour, so I just have to go walk now. It doesn't really feel real yet that she's going to be here. Like,
it's hard to even imagine.
Yeah.
Isn't it?
Yeah. But we'll have to start imagining her being here because she's going to be here forever. No, she's just kicking me.
Come here, Kayla, you're going to come to Cyprus then?
I have the time off.
Have you?
I need to save money.
You should go. Life's for fucking living.
I'm so in
And
debt
getting
this
tanned.
month, like.
Arriving into the delivery suite with strong contractions is Kashini with her husband Tim. They are expecting their first baby today. Kashini has her own opinion on how to do things.
I didn't go for the antenatal classes and I didn't want any medication. I'm against medication.
She doesn't even take in Panadol.
Painkillers, I think that's big. It makes me tipsy.
Yeah.
It was very intense and, horrific really, the pain that she was feeling. It would be quite rare for a first-time mom that you'd see such a quick progression. Like a contraction, if you can imagine, is all like your stomach muscles just squeezing in to kind of expel something, and that's kind of what a vomit is as well. She was really feeling sick and miserable through the contractions.
Oi, 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 oi. Relax. Breathe, breathe, baby.
I'm breathing!
I know.
You're doing great. It's all a big rush now. You're doing great. Where are you from, Kashini?
Mauritius.
Mauritius, lovely. How long have you been here for?
So we've been here since 2-3 years now.
2 or 3 years. You have an Irish baby?
Yes. Polish, Mauritian, Irish.
We met on Facebook. He sent me relationship requests. I find it really cute, so I accepted it. Because no boy ever dared to send me relationship requests online. I was like, I don't even know this guy. He's never been to Mauritius. I've never met him in person. Why? So it was just an online thing, yeah? I'm still safe. I know him from September 2014, and literally he booked flight for February 2015. That was our first time we meeting, first time, our first kiss was at the airport.
Yeah.
You're doing great now. You're going to have your baby in your arms really soon.
She was worrying how she will because her pussy was 2 centimeters, but now it seems that it got very fast.
I think it was just a kind of lost in translation that you might get a little bit confused with some of the names for things. So yeah, that was really funny actually. I was trying not to laugh.
Very good, baby. You see, the pussy is right. Okay, now everything goes well now.
10 minutes after arriving into the delivery room, Kashini is fully dilated and nearly ready to start pushing. Her labour has been extremely quick for a first baby, and Kashini is coping as best as she can without any pain relief.
I'm not crying. I'm just trying to make it through. I have small, openings, so I have to make it come out, make it through.
My back.
So you sit forward with me, Keely. Okay. That's it. Come on, sit forward with me. Well done. Now we're going to get you to come back in the bed. So put your 2 hands behind you.
Yes.
And lift back in the bed.
I have toilet. My poop is coming out.
It's okay.
That's your
My
baby.
poop is coming.
I'm screaming, my poop is coming, my poop is coming, move out. That's how I was screaming, but it wasn't poop. The midwife nicely told me, oh, it's not poop, it's your baby.
Yeah.
You need to push more, you need to push more.
If you want, grab my hand. Grab my hand. Grab your hand. Yes. Relax.
My legs falling.
You're doing great.
Judging by her and how distressed she was in like a lot of pain.
Breathing.
When you're in that terrible pressure and you're feeling all of that, it feels overwhelming, like you feel like it's never going to end.
So the next time you get a contraction, I know you want to scream and you want to just let all that pain and that pressure out, but if you take a breath like this, and if you hold it, no, not like that, like this, and push into your bottom, like you're on the toilet doing a poo, you'll have your baby, okay? Because she's getting tired now, so we
You
need
have to keep it the inside.
Exactly, yeah. Can you do that? Do you think you can do that when it comes?
I was so excited that the baby is coming to me, to my hands, that I actually didn't even notice that she's in the pain.
Yeah, I was like, I felt like I'm losing you.
Yeah.
You're talking with a midwife, now I lose my husband. My life is destroyed, I'm dying. He's flirting with a midwife. Now I had all that weird feeling of,
Oh, God.
you're cheating on me right now, all of you go off. It was all a mind thing.
Stop this, Dimek. I don't need you to rub my forehead. I'm tired.
He was trying his very best to be supportive, but I think at that stage she was just so far into her labour and so close to delivering that really there was nothing that anybody could do to kind of give her a little bit of comfort. She just had to do it and she just had to go with what she was feeling, but I think that was quite hard for him. I'm sure he found that hard.
Stop rubbing my forehead.
Okay.
Right now I'm trying to push a human out and you're doing this to me. I don't like it.
You're going to have your baby in your arms really soon, okay?
Carrie is having her labour induced, and she and Fintan are hoping to meet their new baby soon. The delivery room is familiar to them, since less than a year ago, Carrie gave birth to her first baby, Ellie, who lived for just a few minutes.
Ellie, when she came out, like she tried to cry. And then it just went silent, so it was very silent in the room.
I knew what was going to happen.
Was it what you expected?
Yeah. I think the love she brought outweighs the pain.
Yeah.
Definitely.
The labour is quite a worry for me now. Because Ellie didn't cry when she came out and stuff, that I'm afraid this baby won't cry when she comes out. And just getting her out safely. She's a big baby. So I have a lot of work to do.
And again, big breath in. And again, go on, right down. Go on, right down. Right down. You are pushing great. Contractions starting there now. So big deep breath in. Bring your legs right back to you. Like that, yeah.
After 7 hours of labour, Carrie is pushing hard, but things aren't progressing.
A bit more. A bit more. And again, big breath in.
When it went past probably a half an hour of pushing, I kind of knew that it was a lot harder than last time. And I don't know if I actually was going to move her, because I couldn't really feel progression as I was pushing.
Go on, right down. Right down, go on, keep going. Keep going, keep going, keep going, keep going. Right down, Carrie. That's it. I can't see her yet, but that's expected. Her head has to take 2 steps forward, 1 step back. You'll get there.
I don't care how she gets out when she gets out safe.
I could tell she was definitely running out of energy, and So it looked like you were going to give up nearly.
I can't do another one of them.
Oh, okay.
I really can't.
And I'll just see where the doctor is, all right?
I'm exhausted.
When Martha said she was going to get the doctor, then I kind of thought, right, well, I obviously need help to get her out, like, or she won't be born. But I thought that I would definitely end up in a section. When she said that she was going to do the suction delivery, I kind of thought it would be easier than it was.
Well done. Big deep breaths, Carrie. You're doing amazing. Big deep breaths now. Big breath. Bring the legs right back. And go for it now. Go on, right down. Right down. Keep going. Keep going. Keep going. Keep going. Really hard. Go on. Right down. You're doing brilliant. Keep going.
There goes from being like you, your partner, and a midwife to all these people, and that you know that your baby's going to have to be seen by a paediatrician when they're born as well, which is an added like fear.
And again, Carrie. Come on, big breath in.
It's a lot happening at the one time that you can't actually focus on what you're supposed to be doing, which is pushing.
Your doctor came in and just seeing how exhausted Carrie was, and she said within 5 contractions she'll be out. And it was 3.
Pull up in those legs now.
Pull up in those legs and
Push.
push
Go
right down first.
Go on. Keep going.
Good girl.
Keep going. Keep
Good
going.
girl.
Well done. Well done. Brilliant. Well done, Pat. Brilliant. Well done. 2050.
2050.
Bring baby over. Well done.
Sister.
She is a big baby, the length of her. Let the centre to come, okay?
Oh.
Now. Now, Pat.
Good girl. Come on now. Good girl. Now we want a louder cry than that. I know you do. A louder cry than that. Well done.
As soon as I heard her cry, it was just complete like relief.
Okay.
Just happiness. Just like pure happiness.
Yeah, don't worry, I'm going
Just looking at her, knowing that she was going to be here forever, like, and she was ours, was just like probably the best. Well, it was the best feeling in the world.
love you. You just did not want to come out, did you? No, you didn't.
She's literally going to be our whole entire life.
You were worth every minute of that. Yeah.
Yes, baby. Very good.
Just 30 minutes after arriving in the delivery room, it's time for Kashini and Tim to meet their first baby, with the help of midwife Ellie.
Sometimes because they just can't hear what you're saying or focus on what you're saying, so sometimes you actually have to say, like, look at me and just listen to what I'm saying to you. Especially like that when it happens very, very quickly. It's very hard to kind of comprehend and to take in. Well done. Just breathe. You can. You can. Just breathe. Just breathe. Breathe. You're okay. Loads of pressure there now. That's her head. You're doing great. Just blow. Blow now, Kashini. Blow. Blow. That's it. Just let it come now. Just let it come. Just blow. Just blow. Blow. Let it come. Let it come. That's it. Well done. Now, Kashini, listen to me. The head is out. That's the worst bit, okay? Take your hand off me now. And open your eyes.
I was super happy. I was like the biggest thing I could possibly like. She can't give me anything else, so that we're probably happy about.
I wish my whole family was here. My mom was here in Ireland, like with me that moment. It's not that I only want to share with my husband, but whole family.
Yes.
That all happened so quickly
You
for
born
you.
on 4th of February, no? Yes. Yes. Yes, my dear.
I always try and guess myself. If I'm feeling the woman's tummy beforehand, I'll kind of make a guess in my head.
I think she's about 2.8 kilograms maybe.
So that's just something I do. I don't know if other midwives do that.
Yeah, 2.88 kilograms.
I probably just got lucky that time and guessed it. I guessed it properly.
Hello, you're gorgeous. You're only a little doll. You're like a little doll. Yeah, you are. Yes. So I'll just give her this little injection and then I'll give her back to you and you can try and feed her.
Her name is Ridaya. Yeah, and it's H-R-I-D-A-Y-A. That's like, you know, a piece of your heart.
Look at her hat, she's so sweet.
Just want her to be happy.
Happiness, happy love.
Good boyfriend.
Yeah.
She had so many boyfriends.
Until 40. Oh, you okay? Yeah.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done. You're okay. Your baby's nearly here. Oh, here we go.
I have never won the Star Midwife trophy.
This belongs to me and Savannah.
Yeah, it rotates, obviously.
Between the two of them only. No other member of
Midwife
staff.
of the century and then Star Midwife.
No other member of staff have ever received the trophy. They just passed it amongst themselves inappropriately.
Jealousy is a desperate thing in outpatients.
Walking the Rotunda's corridors, trying to get labour started, are Dubliner Sarah and her husband, Kilkenny native Dara, who are expecting their first child.
We met December 2015 on Swiping Right, Tinder. Didn't know he was a culty when I swiped right. That was, he hadn't got that, so don't know whether. I'd never given a countryman a chance before.
I'd never given a double chance either, so we're both ways. Sarah's a very happy-go-lucky person. She's very, very positive. I think she rubs off on people in a nice way. I think she has nice energy.
He was the fella that my mum always wanted me to bring home.
Don't put that in.
He balances me out. I suppose I'd be very more live wire kind of out there, so we're a good yin-yang for that. No, he was definitely the man that my mum wanted me to bring home. After many frogs.
It's a relief to be in the delivery suite after a fitful night in the annex, waiting for labour to begin.
First-time parents didn't realise how long the process could be, so obviously hear stories, some people are very quick, some people are, see, like us, not as quick, so we didn't have visions of maybe being there that long.
Sarah and Dara have found out they are having a girl.
And is she going to be the first of many grandchildren, or? She's fourth on my side, third on theirs.
Third on my side, yeah.
Third, oh God, that is so exciting, isn't it? Yeah. So.
Everyone's waiting on the phone, I think.
Absolutely, I'd say the phone's been ringing off the hook. And do they know that it's a girl? Yeah. I can't keep secrets. No. And did you have any plans for delivery or anything? Had you read anything you were like, oh, I'd love to do that? No, just listen to the professionals. Like cut the cord or anything? Would anyone like to cut the cord?
Cut the cord?
Yeah. Lovely.
Let's do that, all right.
Our bare plan, I suppose, was just listen to the professionals, trust them, take their advice, go with what they were saying.
Take all the pain relief that's been offered.
Yeah.
She's never been asked before in her life, if I'm afraid.
Really? Last night was my first night staying over. Was it? Well, that's good. Healthy.
Yeah.
Healthy. No need for a hospital.
Exactly.
Last time you were here, it was probably you as the baby, wasn't it? Yeah. I was born here. Were you born here? I was. Oh, fantastic. And I was an attraction, apparently, because my mum was only about 4 foot. Oh, really? And I was 10'8", and I was a week early. People are were coming from everywhere to see the big baby that came out of a small woman. Out of small. My mum is tiny, in height and frame and all, so I was like, oh God, if she had a 10-pound baby, I'm tall, and what way is it going to work? So that was a bit of a concern.
Can you generally tell how big a baby is by looking at someone?
Give a good guess, yeah.
What would you think that
I'd
baby's
say
going to weigh?
it's a good 8 pounds.
Yeah?
Yeah. 8.5.
It's like the snapper, what was that? Was that turkey? Was it 9 pounds? Is that a baby or a turkey?
Is that a baby or a turkey? I hate feet.
I'm dying to get my toenails done. I feel like it's the only way I can treat myself in here. So just get your nails done.
I know.
I'm dying to get my lashes done as well.
Where did you get your lashes done?
On Dorset Street. Yours don't look particularly
No.
fake though.
Do you think?
No. I'm 3 years getting them every month. I'm fully
Every
addicted.
month?
Every month.
What?
I've given her probably 10 grand.
This is the umbilical cord here as it goes into the placenta. So this is the baby's head up here.
In fetal assessment, Ellie, a patient from Dublin's Coombe Hospital, has been referred to Professor Malone. Ellie is 31 weeks pregnant, but her baby has been diagnosed with Reese's disease, a condition where antibodies in her blood are destroying her baby's blood cells.
And this is what we call the middle cerebral artery.
Ellie has 4 other children, the last of whom was also affected with Reese's disease.
I wanted to have another baby. I knew it would have to be a pregnancy that was monitored a bit more closely. But I probably didn't realise quite how, as the pregnancy went on, it was worrying, wasn't it, towards the end.
And the flow of blood in the middle cerebral artery suggests that the blood is flowing very fast, which is consistent with significant anemia.
Okay.
So I think these Rhesus antibodies are crossing the placenta, are attacking the baby's blood, destroying the baby's blood and making the baby anemic.
The antibodies can cross the placenta and attach themselves to the baby's red blood cells, and that causes those baby's red blood cells to burst, or hemolyze as we call it, and that can lead to profound fetal anemia in that baby, which can be fatal if not treated and not detected early.
Just looking to see if there's any evidence that there's heart failure.
Well, about 50 years ago, this condition was quite common because we didn't have any prevention for Rhesus disease. But with the advent of anti-D, the prevalence of the disease has decreased significantly. And so we would see a woman with Ellie's level of problem maybe only once or twice a year.
Whilst Ellie has had anti-D treatment, this has been unsuccessful. So the next stage is a blood transfusion for her baby.
In Ellie's case, her ultrasound findings were already showing evidence of severe anemia, so we arranged for the fetal blood transfusion to be done within 24 hours of her first meeting us. We'll give the baby sufficient blood to take the baby out of the danger zone, and that should ensure that your baby will be safe for the next 2 to 3 weeks.
And it must be a fine balance, you know, when you're talking about the heart failure.
Yeah.
It's a fine balance for you to decide whether to do this or deliver.
I'm very confident, looking at how the umbilical cord is set up and the anatomy here, that technically we should be able to get a needle into the baby's umbilical cord.
Yeah.
And technically, I think we should be able to accomplish a transfusion fairly easily. Obviously, at 30 to 31 weeks, the baby can survive outside the womb. So if we saw the baby getting into trouble, we absolutely would go for the to help the baby out.
No, that's brilliant. Thanks very much.
Okay, let me give you a hand up.
Thank you.
We'll go from there.
It's indescribable as a father to look down and, you know, see that this little bundle of joy has now entered your life, and it is the best feeling in the world. People tell you about all the downsides and the sleepless nights and all that, but, you know, it's worth it, absolutely worth it.
We only got married in March, like this was a bit of a surprise.
I was looking at your ring, it's gorgeous.
It was a surprise, like, wasn't really...
Baby was a surprise, or the wedding was?
The baby. Like, we had the wedding planned nearly 2 years.
We had planned, I think, to get married first, obviously, which we did, but I don't think we'd planned for it to happen so soon. But I, myself, I think you were probably the same, that we didn't want to be too old having kids either. We're both in our early 30s, so we want to kind of do it now and enjoy them growing up.
Oh, good. Okay, so look, we're about 2 centimetres now. It's come around to the front, and baby's head is moving it. I think I can feel a little bit of hair. I think baby has a bit of hair there, yeah.
I must have been crippled with hair.
So at least that's the reason why.
Yeah.
The whole way through, Sarah was getting really bad heartburn, and obviously one of the old wives' tale is that a lot of heartburn tends to have a baby with a lot of hair.
Yeah.
And the few scans we had, I thought myself, looking at the screen, I thought like she had hair from what I could see.
I never had heartburn in my life.
You were born with
I had
hair,
a full head of hair.
Oh, there you go then.
Yeah, serious head of hair. She's starting to feel a little bit of pressure. Now she's contracting. We've been moving her different sides. She's contracting 9 there, but she's been contracting like 7, 8 sometime.
I don't pay into places.
Not really. Like, no, just
walk in. No, not that I walk in. I just don't want to. I don't go to places that you pay in. Like, I don't go to nightclubs.
It's just like music bars and stuff.
Yeah, like if you bring me to, where's that, Zico's, is it?
What's that like?
Do you have to pay in?
Mental, but like you're like paying a tenner and you're like that, and then you feel really old, so you feel like.
Yeah. Is it good?
Yeah, it's good if you're 25. Everything's good if you're 25. That's why I have to stay in Donny Nesbitt's where there's 50-year-olds there and you feel like young. Yeah.
I know, I'm too old for nightclubs.
Too old. Yeah.
We just have to get on to.
On the prenatal ward, Ellie and her husband Owen are getting ready to go to theatre for their baby's in utero transfusion. They'll never forget where they first met.
We met in London, didn't we?
In Bristol.
Oh, Bristol. Sorry. Yeah. He said the blood is nearly ready and that they might have a slot in theatre in half an hour. So I was only ringing you just to say that, not to make you.
We met on the night out?
Yeah, in an O'Neill's Irish bar. And there was a group of us that night and there was a group of Irishmen, so... but I was the only one who got lucky. All these years later.
Although this is the couple's 5th pregnancy, it's the first time Ellie has had to go through a fetal blood transfusion.
With rhesus disease, the mother becomes more sensitised to positive blood with each successive pregnancy. So we tend to see the baby getting anemic earlier and earlier in each successive pregnancy.
Yeah, I'm thinking, yeah, I think I'll stand over that side. Yeah, so machine up here, yep.
The hospital environment is a familiar one for Ellie. She works as an ICU nurse in Crumlin Children's Hospital in Dublin.
So I'm sure this is all fascinating. This is standard ICU day for you, isn't it? Yeah.
So being a nurse, you know, you see some really sad things and some things that you just think, I never want to be in that situation or that position, and especially with children, you know.
Yeah. The hardest bit for you here is that you have to just stay still.
Yeah. The things you've seen, not a lot of people would have seen unless you work in ICU.
You can breathe. You can breathe, but just you have to stay still, because as you probably heard me saying there, the needle is going to be in a very delicate spot.
I think it does make you just realise how fragile life is, definitely.
Suzanne? Sarah, will you just tell Suzanne it's Jane here, we're about to start. Thanks.
In 1 or 2% of cases, the baby will not tolerate a fetal transfusion, and there's a possibility that during the procedure, an emergency caesarean section might have to be performed if the baby's heart rate slows down.
Just there, that's exactly there. Little cramped now, I'm sorry. You take the probe.
A needle is placed into the umbilical cord, a tiny space only a couple of millimetres in diameter, and the baby is constantly moving.
Just sample 1 for our HemaQ. Sample 2 for the lab.
Working against the clock, the hospital lab must analyse the baby's blood before the transfusion can take place.
We can't wait, possibly for hours, for a lab result to come back to tell us how anemic the baby is. We therefore pause our hospital laboratory and keep everybody on standby, waiting for the arrival of the blood sample so they can tell us within a minute or two how anemic the baby is.
Suzanne? Sample 1, pre-transfusion. Okay, thank you very much.
This allows us to calculate the precise amount of blood to transfuse into the baby. If you don't transfuse enough blood, you won't prevent heart failure. But if you transfuse too much blood, that can also be dangerous for the baby. So we need constant guidance from our hospital laboratory as the procedure is going on as to how much blood to give and whether we've got to our target level.
Hi. MCV 94. Platelets 2 and 9. Thank you.
Oh, yes.
When you're lying in theatre, you are thinking, oh gosh, what's happening inside? Because obviously all the doctors and experts in the world, I suppose nothing is guaranteed, so, and they have to tell you the risks, and there are risks obviously doing a blood transfusion, so definitely it's stressful.
Okay, off we go, and hopefully you can go a good speed on that if you can, because we're definitely in a good spot there.
So
I'm very
it's
happy
actually
with
going
that.
in nicely.
Yep. Baby's behaving very well. That looks like an artery below there. Don't you just take the artery? Yeah. Doing very well. We just need to stay still for about 3 or 4 minutes, and we should be fine. I presume it's a contraction in the uterus has just lifted us just now. It's amazing how the movement from a contraction. Okay.
I stupidly didn't really think that it would cause labour pains. But I suppose if they're putting a needle in and they're aggravating the uterus, your uterus is going to contract. I wouldn't say like full-blown contractions, but definitely kind of halfway there.
been almost 40 hours since Sarah's waters broke. Midwife Ciara is examining her to see if the long wait to meet their baby is nearly over.
Fantastic. Right. That's brilliant. So you're 10 centimetres. Forgot to deliver that news. And we might just do a little bit of a push down, just see with this next contraction, and we can see where baby's head goes to. Okay. We wanted Sarah's labour to progress because it had been a little bit slower because the waters had gone for such a long time. We wanted things to progress a little bit quicker. Down, more. Right down, even more. Right down. That's it, well done. Brilliant, okay. And we'll wait. Do you know what we'll do? We're gonna wait. We'll wait the hour, okay? Right, okay. And allow, baby's moving when you're pushing. Just if we can allow you to have that extra bit of time where you're not using all your energy. Okay. Okay. And just let baby's head move down.
After an hour, midwife Melissa starts her shift, and her first job is to get Sarah pushing.
It's lovely to meet you.
This is Sarah and Dara.
Come on, go on, push here. That's it, very good. Keep it coming. Excellent, well done. Very good.
After a while of pushing, I asked her to go on the side just to try to help the baby to rotate into a good position.
Keep it coming. Okay.
But this unfortunately didn't help.
I was pushing for an hour and nothing was happening. And I think then I was starting to get upset with myself. I was like, I'm doing this wrong. I'm not doing it well. And, I was taking it to heart. And I was exhausted at that stage.
The head hasn't really come down much.
What do we do?
Usually, after an hour of pushing, I'll get the doctor just to see if we can do anything, especially she needs to rotate into the right position, this baby. I think she's facing sideways.
I decided to inform my senior midwife that I needed a doctor review just because I was having a few concerns that the baby was getting tired, so I just wanted one of the doctors to come and have a look.
Slow deep breaths, Sarah, slow deep breaths.
You're pushing very well, okay? I think baby needs some help. It's just the baby's head position.
Yeah.
It's just, baby's trying hard, it's just on a little bit on the tilted angle. So we may have to apply a kiwi cup or a forceps. I have to just see, we'll put you in the position, we'll ask you to push again and see if the baby's head comes out. The kiwi cup may pop off because of that swelling. I'll push you in the position and examine, and then decide what we can try. Is that okay? Yeah?
Right, you ready? Many a red sun will set, many a blue moon.
That's a song, yeah.
What is it, a song?
Yeah, that's a song, yeah.
Oh, well, I don't know that.
Yeah, don't worry about it. Either way. Hi,
Right, Ali Hakim.
Hello, Ali Hakim. Ali Hakim.
Get away!
Hello, kiddo.
Oh, Jesus.
Hello,
I'm
kiddo.
sure sorry to see you so happy, because what I got to say will make you miserable. I got to marry Will. That's the way it's wrong.
Good morning.
Hi, nice to meet you.
Nice to meet you. Peter is my name. I'm one of the anaesthetic doctors.
Yes.
Ellie has been admitted to Dublin's Coombe Hospital. She had a second blood transfusion in the Rotunda, and now it's time to deliver her baby early by C-section.
Ellie, you're having a section today?
Yes.
That's your first section,
Yeah.
right? And you have 4 children?
Yes.
2 of them were delivered with the forceps and 2 non-vaginal deliveries. Did you have
The doctors feel it's safer to deliver the baby 6 weeks early, rather than have it become anemic again.
I didn't want to do another blood transfusion, and I think they thought at 34 weeks it was becoming a bit more risky to do another transfusion.
Thanks very much.
See you upstairs then.
Thanks
Okay, all the best.
Bye.
Then they rang me on the Wednesday morning after they'd had their big talk, all the doctors together, and they rang me just to say, yeah, if you can come in tonight, we're going to deliver you on Thursday morning.
So Ellie, they're just going to pop a catheter in. Now you won't feel any pain. You might feel touch, but no pain. It's kind of Like a funny, dissociated sort of thing.
You all right?
There was definitely a few evenings I came down to you during when we chat at the kitchen table, and I definitely felt like I'd rolled a dice. Yeah, definitely.
I'm trying to avoid those vessels, yeah.
A few times we were sort of saying to each other, God, if we'd known all this was going to happen and the potential risks, would we have gone ahead at that stage, knowing what we know now?
The head is down, so it's nice. Now, suction when you're ready, thanks. Okay, and under pressure now.
I think it's just you never know with life. That's the problem. That's why people have babies in the first place.
That's great. Ellie, we're about to have your baby. The quick way. Oh, gorgeous. A little man.
Well, boy, that's what you thought.
And in ICU, you've seen so many emergency situations. It was all very controlled. There wasn't an emergency. I knew the consultant neonatologist was there. Because I've seen so many emergency situations, I could tell it wasn't a case of an emergency. Does that make sense?
That's great. Thanks very much.
Congratulations.
He looks really like Oscar, actually one of our other sons.
We haven't done a weight or anything yet. We'll do that when we get him down to the baby unit.
Definitely in that situation, I find you're looking around nearly, looking at reactions and how people are in terms of their facial, or do they look stressed, do they look, whereas it didn't, it was all very calm, which was great.
Yeah, that's good.
Looks great.
Did you get a photo?
Yeah. Looks really like Oscar, actually. Oh, sorry.
Oh my God.
Yeah.
Everything is good here. Okay. We're just going to move on to the tubes.
Yeah,
okay?
that's great. Thank you. Yeah.
So the next conversation that always happens after some very complicated pregnancies, what happens the next time round. We know that it's very likely that the baby, a subsequent baby, would have a similar, if not more severe presentation of the condition. And that's difficult to face into.
Ellie and Owen made the decision to have a tubal ligation to prevent further pregnancies.
The thing is, you don't have 3, 4 kids unless you like having them. So, but at least with 5 kids, there's a good chance of quite a lot of grandkids. So.
Get to meet your mum.
Just have to get another dog. No, only joking. No, 5 is a great number. Yeah, 5 is just perfect.
I'll see you in a bit. Cheers, thank you.
A very special occasion at the Rotunda, celebrating their 18th birthday. Connor and Amy and Cian and Rory and Derval Cassidy, who are, of course, our famous Rotunda quintuplets. We know that quintuplets are tremendously rare. Ireland has only one set of quintuplets, and they're here today with us.
Having 5 25-weekers born at the same time and being cared for in the neonatal unit was always going to be a challenge. Statistically, babies that are born between 25 and 26 weeks, back in 2001, the survival rate was 50 to 60%. So the fact that all 5 survived and all 5 are healthy and well is a huge achievement. Quintuplets is a story that any of us that were involved in caring for them will never forget.
Do you have a baby? Okay, come on. Go, Sarah. Deep breath in and push all the way down into your bum. Come on. Big push, keep pushing. Bring the legs up to your chest. Yeah.
It's the baby's head. It's going.
You're gonna feel loads of pressure. It's completely normal. But you push with the pressure. Keep pushing, Sarah. Don't be afraid.
Good girl, go on.
Come on, go on.
Back in the delivery suite, Dr. Samaya is using a Kiwi cup to help deliver Sarah and Dara's baby. Dara is finding it hard to watch.
Keep it coming.
It's quite difficult from the dad's point of view, especially when it's an instrumental delivery, because they don't really know what to expect. Everything looked very, very dramatic.
Keep blowing.
I was starting to panic a small bit at that stage. Obviously, I didn't like to see my wife in pain. She'd gone through a hell of an ordeal over the 27 hours, and I was thinking of my daughter then as well. Obviously her heartbeat started to drop. So it was all just getting a bit worrying at that stage. We'd gone this far in 9 months and it would have been just heartbreaking for anything to happen.
The head is out with the next contraction. We're gonna see her. Okay, it's coming. You ready? Legs right back to your chest, right back to your chest. Keep pushing, keep pushing, keep pushing, keep pushing, keep pushing, keep pushing. That's it. Blow, 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 blow. Hello. Congratulations, guys. Congrats. Oh my gosh, she's a big girl. Have a look at her. Oh my gosh.
No, go.
Yeah. Just 1 second, the sharp eye.
Okay.
Okay. Congratulations.
Okay.
Yeah, it was just amazing to see her that first time. Like, as Sarah said, when I heard that first cry,
Yeah.
I think she was there was a bit of like a couple of seconds wait, so it felt like an eternity, but once she gave that initial cry, it was just brilliant.
I remember the doctor explaining what she was going to do, but not really taking it in. And the next thing was just like pop, and the baby was there.
Dara, do you want to cut the cord?
Did you want to cut it?
Oh my gosh, she's so beautiful.
Just in between the two?
Here?
Yeah, there.
Oh, my hands are slipping.
Bring her over, say hello to the baby for a second.
I have her.
I'm sorry, I can't do it. I'm afraid I can't.
You're all right.
She looks like Dara.
It was funny, the midwife was like, oh my God, she's so like her daddy. And I was like, oh my God, 9 months and all this I've gone through, and now she looks like him.
Oh, Jesus, I love you so much.
Like when she looks up at you and she's giving a gap, like you just completely, do it again tomorrow without a doubt. Maybe not so soon, In a while we'll do it again. But
I have to agree to it as well, so let's see what it is.
Oh God. 8:15. She is 4 kilo 05.
She'll never forget her roots, because obviously I'm from the country, so I'll always have that in her. She can follow Kilkenny and hurling and Dublin the football. I think that's probably a good balancing act.
So she's not far off. She's not far off, £9 then.
Yeah.
Yeah.
I know.
We should still have a big double accent.
She might talk properly like me, you don't know.
She'd be like, Dad, why do you talk different to everyone? We'll get you a Dublin jersey too.
No thanks, I'm alright. Definitely don't want that in the TV.
When it's a full moon, it will be like the hospital will be crazy. It's actually real. Like, it's real, and it's not only in Ireland. I can assure you, like, it's the same in Italy as well. Like, if it's full moon, you just need to pray like that the shift will be okay.
Down to the left here.
Arriving into the delivery suite, expecting their first child, are Laura, an air stewardess, and Raz, a waiter, both originally hail from Romania.
Do you know any cool moves?
Any cool moves? See that poster there?
Yeah, I saw.
These are all very good. But
that's the coolest one.
That is the coolest one, yeah.
I wanted to give birth natural, without any injections or medication or. So the contractions will be stronger and more painful, or like our mothers, be natural, everything.
Old fashioned, I'd say.
They probably will progress a little bit, but they're already doing a very good job of opening out the cervix.
I didn't want to hurt the baby. I read books about the epidural and taking medication during pregnancy or in labor, and this might hurt the baby.
Come on in.
Hello, how are you? Hello, how are you?
She had a few concerns about getting an epidural. Thankfully, getting epidurals is lovely and safe, and it's really safe for your baby. She didn't want to get it, and that is perfect. So Katie is going to take over from me, okay?
Okay.
But I'll be coming back in later to see your little boy.
Yeah.
Good plan.
We met in 2014, in work. We used to work in a restaurant industry. She was a receptionist, I was a waiter.
Any flowers?
I was all day here with you.
It's Valentine's Day, no. Oh yeah, I forgot.
For me, it was easy. It was love at first sight.
This is the most romantic present, a baby.
Oh. Now I'm happy he's a boy.
Really? Oh
Yes.
yeah. You know what women have to endure.
Exactly, before she wanted a girl. And she saw what's happening and she said, no, I'm glad it's a boy now.
I don't want her to suffer.
I wanted a kid. I wanted a baby. In the beginning, she wasn't very sure she wanted one, but I keep pushing her, come on, it's time. It's like, look, it's time.
I think your jobs are harder than mine. Working in an airplane with drunk people and...
Oh my God, yeah.
Hats off to you, you know.
I work as a cabin crew. To have a baby meant to stop flying, so I love to fly. That's why I wasn't prepared to have a baby. And especially when you have delays and it's not your fault. They don't understand that.
People get very frustrated, don't they? And they take it out on you. Yeah.
I love aircrafts. I just love
Sometimes
flying.
she'll sit in the garden just watching the planes take off
Yeah.
in the back of
I
the
go
car.
to the airport and watching the aircrafts.
Yeah.
Oh,
So I'm getting, whatchamacallit, slide ropes. Oh, lovely. Slide rope there. That's the bottom of my bed. And then that.
Although I don't think I could get up every morning and be looking at myself in a mirror.
Oh no, I'm not going to. I'm only going to get one mirror in the middle, kind of maybe up high.
Okay.
And then in the boys' room.
Do you not have them on the ceiling, Louis?
Oh yeah, everywhere. Oh my God, can you imagine?
That would be nice, actually.
Emma and Martin are in outpatients for a Milestone checkup with their son Nathan. 7 months ago, baby Nathan was delivered in the Rotunda at just 25 weeks gestation, after mum Emma was rushed from Ballinasloe Hospital. Weighing less than 900 grams, he was gravely ill. His sudden arrival was a shock for Emma and her partner Martin, who had been together for only 7 months.
Lights blazing, gunning it up the road. The on-call doctor comes in, checks me, and goes, I'll be honest with you, baby's feet are actually out of the cervix. He's kicking out of the cervix. He was that low down. And I was like, what does that mean? She says, very high chance baby's coming tonight.
He's looking great. I feel a bit better now, but it's a bit, you know, when I heard about the ventilator this morning, it was like, oh, kind of the end of the world, but I'll admit I had a bit of a breakdown. That happens though. But you're expecting setbacks, but you just have to think logically about it. And then I was saying to myself, see, I suffer from mental health anxiety, and I said, am I cut out to be in this position? I'm doubting myself. Because I should be there to support her and him, but I'm kind of finding it tough. Like, it's just the whole thing is daunting. Like, I'm thinking too far ahead of myself, to be honest with you. So, I mean, I'm delighted with his progress, but it's still, I can't even think. When I'm home, it always comes back into my head, even when I'm enjoying myself, I say, oh, he's in here. It's not easy.
The thing to remember about neonatology is that we're not really just only caring for the baby, we're caring for the whole family unit, and that's the whole premise of family-centred care, and that we provide care to the parents as well as the baby in the intensive care unit.
Nathan spent 6 weeks in the Rotunda's ICU and a further 7 weeks in Galway Regional Hospital.
Straight into the mouth.
Today he's back in the Rotunda for the first time. The team want to check his heart function.
Nathan would be 7 months or 4 months corrected, considering when he should have been born.
He's been born on the 22nd of September, so.
Yeah, and weight-wise, where he started off at £1.15, he is now a stone.
Officially today we weighed.
Officially today he was weighed, and he's a stone in weight.
So he's
huge.
7 times his birth weight.
Yeah.
Look at you.
He's like, I think I know you.
Yeah, do you remember me? Huh? You're a buster. You're a buster. I'm just checking the heart at loads of different angles. And I'm basically making sure that there's no little holes in the heart, which we know from before that there isn't. I'm making sure that the heart is pumping well, and at the moment everything is looking good.
No.
So this, what is the noise indeed?
That's your heart.
Yeah.
It's my heart as well, I think, at this stage.
Is it?
Yeah.
It makes me laugh, right? Everything he put us through in 13 weeks, and it's the slightest sniffle that makes him panic now.
Isn't
Isn't
after
it?
all that, like, when you have him home, it's just like...
I think it took a few days for it to kind of kick in that, like, it's okay. We're good.
What size, what was he in comparison though?
Oh,
When you're looking
like,
back.
I mean, if you look, I'd say he was barely his torso. If you were,
When you're, I mean, it's hard to imagine, like, but, you know, looking back. But... Well, I think I'm coping well, but I've had a few panic attacks.
It's Daddy. Hey, yeah. It's Daddy. Hey, yeah.
He's getting there. Like, I mean, considering the anxiety issues he has, he's doing marvellous.
Thanks very much.
Thanks a million. Thank you so much. You were great.
Thank you.
Oh, and we'll see him again at some stage.
Emma and Martin are going back to the intensive care unit with Nathan for the first time. It's a place of heavy significance after a difficult 6 weeks spent there.
It was just like, oh my God, my heart was pounding, because it's just like the last time I had to do this route, we couldn't bring it home.
This is a bit weird coming up here on our...
Hello, Nathan. How are you? How's he doing? Grand, he's perfect. He's absolutely flying. We just got him weighed, so he's over a stone in weight.
And it was so nice to see familiar faces again, and they were talking to him, and
delighted.
couldn't get over him because, like I said, he was barely a couple of pounds the last time they would have seen him. Stop snuggling into me. Talk to people. You have to tell them.
How are you? Welcome back.
It's lovely to see you. You're brilliant. You're like a role model for all the little guys inside it.
It's like his mother asked me recently. She says, just out of the blue, she asked me, she says, now that he's home, he's safe, he's big pudgy baby, can I ask you something? I says, go on. And she says, did you think he was coming home? And in that moment, I had to think about it, and I said, I'll be perfectly honest with you, I thought we were planning a funeral. And I will be honest, I thought we were going to bury him back then, because there was so much wrong, and he was so tiny, and realistically, he was just barely past viability. So it was just, I suppose I did think at the time, and then I kind of closed it off and was like, don't think about it, because if you think about it, it's going to happen.
Yeah,
You're going to make
I was
yourself
the same,
sick
actually.
thinking about it. So then now, when he's like that, and he's big chubby baby, and he's smiling up at you, I can say to myself now, oh my God, you're a miracle, because I really did not think we were going to get to this point. I honest to God thought that was it.
Are you okay?
For the parents and for just us going up and down, and I know it's what it feels like. You're not kind of away, you know, and it's kind of like you're given kind of hope, but then again, anything can happen, as I said.
He's all in one piece, you know.
Sorry.
You look in there and you see those small babies, and you kind of go,
They have a long road ahead of them.
We were there, and God, we're here with you, because we were there, and we saw the surgeries, and we saw the heart issues, and the sepsis, and the transfusions, and We went to pieces so many times and fought like cats and dogs when we got so angry with the situation that shouting at each other was just the easiest way of dealing with it. We've been there and it's the hardest road you will probably ever do, but it is worth it in the end.
I think it's a mix of the teeth and hunger.
Ah, jeez, it's absolutely gnawing on you.
Ooh. Dă-mi un pic antiperspirantul și parfum. Serios.
frate.
Da. I put makeup. I was with makeup on and my hair was...
That's why we were late in the hospital, 2 hours. So like she had her hair done, makeup on, everything. Unde ți antiperspirantul?
Pe acolo.
În asta mare? Aici?
Caută-l. I didn't want to look like an exhausted mother.
Ce asta?
Shampoo.
Este șampon?
Yeah. I wanted to be pretty for my baby.
Anything nice now? Take another nice one.
That one's nice.
It's all right.
No, it's not.
It's there.
Laura has been labouring for 5 hours. She's coping well with her pains by moving and keeping upright.
Katie told me that it would be easier because of the gravitation.
A little gravity work for her. Yeah. There was a panel there with a few positions that she can sit. She chose this one. It was like the most comfiest for her.
I might take off the underwear, okay? Because it sounds like you're kind of getting ready to start pushing very soon.
Yeah.
So if maybe we just take off those underwear, because you can't have baby in your knickers. We need to take off. We need to take off the underwear.
Really?
Baby needs to come out.
How high is the head down?
It's kind of -1.
Right, okay.
There's an anterior rim there.
Right. And she is a prime up, isn't she?
Yeah.
But she's coping well. She's no epidural or
No,
anything?
she's coping with it so well.
Right, okay.
I tried to talk to her into taking something to the epidural. She didn't want to listen to me. Like, ease your pain.
Yeah,
It's
the
normal,
labor
everyone
was
likes
so
to ease your
bad.
pain. She didn't want to. She's my hero for that.
And blow. And another little push now.
The whole experience was absolutely new for me and a bit shocking, I say. I didn't expect to sit there until the end. It's not common in Romania. All the hospitals they have a policy. It's only the doctor that sits in the room and the nurses. It is very important for the father to be there when the baby comes out, because not the doctor is the father. It's you that's the father. You have to hold him in the arms. No, first, not the doctor.
Blow, 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 blow. And another little push.
He's bit.
Little push again. Oh, that's the head out. Well done.
Oh.
Let's see. Hello, Stefan. 11 minutes past 6. Now, just to wait till the head rotates around, okay?
And now?
Just breathe until the next contraction comes, okay?
E bună tot, săracul. În bot.
Give it a little push there and see what happens. Small little push. Blow. Push. Hello there. At 13 minutes past 6. back a bit. Say hello to your mummy. Oh, congratulations.
It was
I couldn't
you can describe this.
This is the most magical thing ever. When you hear him and when you actually see him and feel him on top of you.
What's wrong?
Really cute. Nothing is wrong.
What do you think of him?
I didn't imagine him like this, but he's so beautiful.
I don't know what to say.
Speechless.